NCLEX RN practice questions. Wilda Rinehart. Question 1. Set 1. What does alopecia mean? Loss of appetite, loss of hair, loss of hearing, loss of skin pigmentation. Alopecia is the medical term for hair loss. Question 2. Set 2. HbA1c levels reflect glucose control over what period? 24 hours, 1 week, 3 months, 1 year. HbA1c measures the percentage of glycated hemoglobin over the 120-day lifespan of red blood cells. Question 3. Set 3. A patient is hearing voices that say, "Kill yourself." What should the nurse ask first? How long have you heard these voices? Do you have a plan to carry this out? Why do you think the voices say that? Would you like some medication? Assessing for safety and a specific suicide plan is the priority when a patient reports command hallucinations. Question 4. Set 4. What is a major safety risk for toddlers? Sports injuries, poisoning and drowning, occupational hazards, elder abuse. Toddlers are at high risk for accidental poisoning and drowning due to their curiosity and mobility. Question 5. Set 5. What is the purpose of administering magnesium sulfate to a preeclamptic patient? To lower blood pressure, to prevent seizures, to induce labor, to increase fetal lung maturity. Magnesium sulfate is the drug of choice for seizure prophylaxis in preeclampsia/eclampsia. Question 6. Set 6. A nurse is caring for a patient with atrial fibrillation. What is the primary risk for this patient? Heart failure, thromboembolism and stroke, ventricular tachycardia, hypotension. Stasis of blood in the atria can lead to clot formation and subsequent stroke. Question 7. Set 7. A patient has a suspected fracture. What is the first priority? Administer pain medication, immobilize the limb, apply ice, obtain an X-ray. Immobilization prevents further tissue damage and reduces pain. Question 8. Set 8. A patient with heart failure is prescribed digoxin. Which finding should the nurse report immediately? Heart rate of 72 bpm, visual disturbances like seeing yellow halos, increased urine output, blood pressure of 120/80 mmHg. Yellow halos are a classic sign of digoxin toxicity. Question 9. Set 9. What is a classic sign of appendicitis? Left upper quadrant pain, rebound tenderness at McBurney's point, pain relieved by eating, hematmesis. Pain in the right lower quadrant with rebound tenderness, McBurney's point, is classic for appendicitis. Question 10. Set 10. Which condition is characterized by current jelly, stools, celiac disease, intussusception, Hirschsprung's disease, Crohn's disease? Intussusception causes stools mixed with blood and mucus, appearing like currant jelly. Question 11. Set 11. A patient is experiencing an acute manic episode. What is the priority? Involving them in group therapy, providing a high-calorie, finger food diet, teaching coping skills, encouraging social interaction. Manic patients have high energy and may not sit for meals. Finger foods provide necessary nutrition while on the move. Question 12. Set 12. A patient is post-bronchoscopy. What is the nurse's priority assessment? Pain level, gag reflex, urinary output, blood pressure. The gag reflex must return before the patient can safely eat or drink to prevent aspiration. Question 13. Set 13. Which EKG change is most indicative of a myocardial infarction? PR interval of 0.16 seconds, ST segment elevation, T wave inversion, presence of AU wave. ST segment elevation indicates acute myocardial injury. Question 14. Set 14. A nurse is caring for a patient with neutropenia. What should be avoided? Hand washing, fresh flowers and raw fruits, wearing a mask, high-calorie foods. Fresh flowers and raw produce can harbor bacteria and fungi, posing a risk to immunocompromised patients. Question 15. Set 15. A patient on chemotherapy has a platelet count of 20,000. What is the nurse's priority? Infection control, bleeding precautions, managing nausea, increasing protein intake. Thrombocytopenia, low platelets, puts the patient at high risk for bleeding. Question 16. Set 16, a patient is taking warfarin. Which lab value should be monitored? APTT, point/INR, platelets, WBC. Point/INR is used to monitor warfarin, Coumadin, therapy. Question 17. Set 17, which insulin is considered rapid-acting? Lispro, NPH, Glargine, regular. Lispro, Humalog, is a rapid-acting insulin with an onset of 15 minutes. Question 18. Set 18, what is the priority intervention for a patient experiencing chest pain? Administer morphine, obtain a 12-lead EKG, check blood pressure, call the family. A 12-lead EKG is the priority to determine the cause of chest pain, ischemia versus me. Question 19. Set 19, standard precautions apply to which of the following? Only patients with known infections. All patients regardless of diagnosis. Only patients in ICU. Only surgical patients. Standard precautions are used for all patients to prevent cross-contamination. Question 20. Set 20, which sign indicates a potential complication of a thyroidectomy? Sore throat, laryngeal stridor, fatigue, dry skin. Stridor indicates airway obstruction, possibly from edema or nerve damage post-thyroidectomy.